Probably about 50% of stroke survivors become fatigued, and it's one of the things that many stroke survivors complain quite bitterly about, and there's a clear need for developing treatments. So the focus of my talk will be on approaches to development of treatments for post-stroke fatigue. We're not completely sure. There's some people who are probably more predisposed to developing fatigue, so if they've had fatigue before their stroke, it seems that they're more likely to develop fatigue afterwards. We've got new data which shows that if you are inactive early after your stroke, so you don't do much physical activity, that seems to be associated with getting fatigue later. If you're anxious early after your stroke, then that predisposes to later fatigue. And there are clearly associations with depression as well, although many stroke survivors with fatigue are definitely not depressed. And there's more recent evidence that there might be problems with the transmission of electrical messages from the brain down to the muscles, but that's very new emerging data. We haven't got any good treatments at the moment. We've reviewed the literature very extensively, and we found a small number of trials, none of which were conclusive. So people have tried a variety of different things, so drug treatments, particularly antidepressants, but those don't seem to be effective. People have also tried talking therapies, and they potentially might be helpful. We've done a small study, and preliminary data suggests that fatigue seems to be improved after 6 sessions with a therapist, but that's not a randomised trial. And there's also some evidence that exercise might help as well, so getting people fitter. In the very acute stages, the priority is to deliver acute treatments, so thrombolysis, for example, and enable people to get onto a stroke unit, which we know helps with outcome. It's important also to prevent further strokes, and we have a range of different treatments. But fatigue's been neglected for quite a long time, and certainly stroke survivors rank it as one of the most distressing symptoms they've got. And it's something that we don't really manage very well at the moment.